Hi, so we will be talking about the case about Bruce Wayne, a 65-year-old male who has complaints of low back pain that's insidious, primarily on his right side of his lower back, and it goes down his right buttock. When he's standing for a long time and walking, his eases are sitting down, and other ags include squatting, lifting heavy objects from the ground, and working on his Batmobile. And then he has decreased lumbar extension range of motion with pain, but pain is improved with lumbar flexion. He has 3 to 5 trunk flexor and extensor strength, and then 4 to 5 hip strength. And then upon a posture analysis, he shows decreased lumbar lordosis, and when he squats, he has poor pelvic control. So that is the case. Okay, so in phase 1 of this exercise program, we really want to focus on helping with their directional preference. So right now it's flexion, and then also starting to get some good pelvic motor control. So the first exercise we're going to do will hit both of those things with posterior pelvic tilts. So we'll instruct the patient. I'll have you bend your knees up on the table, and then I just want you to try to flatten your back and push your lower back into my hand, and then just relax. Good. Push into my hand and relax. And so we're just trying to get the cue of those the transverse abdominis to make sure that they're activating that and not primarily the rectus abdominis. And then for this one, we'll do about 3 sets of 15 reps, or until they develop that motor pattern. This is one that they could do a lot more often, so we could do this about 2 times a day, every day of the week. And so that is the first exercise.
So for our second exercise of phase 1, we're going to work on some directional preference movements into flexion. We saw that the patient has increased pain with both walking, standing, and extension, but immediately goes away when sitting and bending forward. So we're going to start with a flexion-based exercise. Alright, so what I'm going to have you do is lay just like this, and then you're going to bring both feet, keeping your back flat on the floor, and tuck your knees to your chest and give your legs a big hug. You're going to hold 3 to 5 seconds, and then you're going to relax them back down, and then you're going to repeat. We'll do 10 times, and then we will see how the pain is, how you're feeling. So if the pain was moving back from that kind of buttock back to the back, that's good, that's what we want. We'll have the patient keep doing sets of 10 until the pain either dissipates completely or until it kind of plateaus at a certain level. And the patient can do this as often as they want. It's just kind of getting the spine moving and decreasing their symptoms, so they can do it as many times throughout the day as they would like.
Alright, so now we're moving into phase 2 of this patient's therapy, and during this phase we want to start introducing some functional positions, not loading too much, but trying to maintain some good pelvic positioning so that the patient can start to integrate this into movements that they do at home. We're not quite to the point where we want to start doing extension-based exercises because that's probably still a little provocative for the patient, but this first exercise that we're going to do is a hip hinge with a neutral spine and some tactile or verbal cueing. So for this, what we want to instruct the patient to do is that same pelvic tilt but in standing. So you want them to try to push to flatten their back and then try to arch their back. And then we're just going to find a neutral position. So once we do, right about there, then we'll instruct the patient have their feet about hip width, and then they're just going to send their hips back to the wall and then squeeze the glutes, come back up, maintaining that same neutral position the whole time. So send them to the wall and then come back up. Yep, and then we also want to make sure that the cervical spine stays neutral as well. Yep, and then back up. Good. So it's just very important that we stay in that neutral position and we're not letting them get into that lumbar lordosis too much, because that'll probably aggravate their symptoms. So for this one, we'll do about 3 sets of 12. And again, or until they develop that motor pattern. It might take a little bit longer at first. And this would probably just be done 3 times a week in the clinic only at first, and then once they get it down, then we'd feel comfortable sending them home with the AGP.
So for our second exercise of phase 2, we are going to be doing a squat with a posterior pelvic tilt. So the patient really likes to work on his Batmobile, and that involves a lot of squatting. So we want to get him back to doing that comfortably, so we're going to keep with that posterior pelvic tilt. So patient, what I'm going to have you do is do that kind of posterior pelvic tilt that we learned how to do, so kind of tucking your tummy, Perfect. Then you're going to do that pelvic hinge. Yep, keep your feet about shoulder width. Hinge, and now you're going to bend down, squatting. Perfect. Knees tracking over toes, making sure that spine stays nice and long. Perfect. So the patient can repeat that 2 to 3 times a week, and we'll do 2 to 3 sets of 8 to 12 reps for that. And then if it becomes too easy, we can add in some weights later on. So that's it for phase 2. Starting off phase 3, we kind of want to work back into that extension movement. The patient can't avoid this position forever. We want to make sure that he can comfortably do it again. So we're just going to start with some pronon elbows, but some things we need to make sure we tell the patient is to make sure that it's not increasing the pain, or the pain's not radiating kind of down into that buttock area again, and we're not losing any flexion range of motion. So we would probably want to do a retest with flexion range of motion after we do this exercise. But what we're going to have the patient do is lay on their tummy. You're going to kind of tuck your elbows underneath you like this, and then you're going to press up on your hands into an extension. How's that feeling?
Good.
Good, perfect. And go back down, and then come back up. Perfect. And we will do this for 2 to 3 sets of 10 reps, and this can be done daily.
Okay, so now we have the last exercise of phase 3 that we'll be presenting, and now we really want to start loading the patient, making sure they do have good pelvic positioning now, and adding some weight and something a little more functional. Along with this, we'd likely also be incorporating an aerobic program, because we know that that's really beneficial for patients with low back pain, but we're just focusing on some specific exercise progressions. So this exercise we're going to do are some box lifts. So we'll pretend this is a box, and then we'd start with about 10 pounds in there, progress to 20, could progress even more if needed. This exercise we do about 2 sets of 12 reps, and then 3 times a week, again starting in the clinic, making sure they have it down, and then giving it to them for HEP. So for this exercise, we're going to instruct the patient to maintain that neutral spine again that we found in the hip hinge. They're going to send their hips back, squat down, grab the box, take a step forward, and then set it on the table. Making sure that we're not bringing that box too far out, because that's really going to make them want to go into an anterior pelvic tilt, so they're keeping it close the whole time. We'll then pick it up, bring it close, step back, and then same thing, squat back, maintaining that neutral spine. So yeah, this is just a very functional exercise, because the patient will likely be lifting objects, and now we also hopefully have gotten the patient back to doing pain-free extension range of motion without losing that flexion range of motion, as Abby mentioned. So that concludes our program. Yay!